Doctor, sorry, the mother and father are in Bangalore or somewhere in the rural part. They have the app. They can check their routines and send it to the son. He can update to us. He can make modification immediate. So if we have an app, we can bring all these whether check it once in a day or once per day. It will help us a lot. It will help us a lot in identifying patients who are heading into conflict early. Correct them. Almost for last 7, 8, 9 years over mail. I have not seen them face to face. I have almost mailed them the medication. The reports will keep coming online. I have guided them they are from Calcutta, they are from Delhi, they are from Chandigarh, they are from Uttarakhand, all parts of India, even Bangladesh. So most of them are doing good. So just these five parameters. One is the oxygen levels, second is the pulse rate, third is the blood pressures, fourth is the symptoms in any breathing difficulty, any cough, okay, and the last one is the cholesterol levels. If they can share these, if you can put all these in an app, and if I get lifetime, real time readings of these numbers, I can go through these numbers, and I can also go through what medicines they are going through. I can guide them as to where, for example, their diet may have gone out of toss. That will have to be sorted out. Or they may be going through some kind of stress. That will have to be sorted out. Or the medicines which they are taking may not be working anymore. That will have to be modified. At the end of the day, you make a diagnosis of pre-diabetes or diabetes, pre-hypertension or hypertension, and teach them how to.
Hello, sir.
Sunil, can you hear us?
Yes, sir.
Sunil,
Yes, sir.
I have made a statement. I think this was in continuation of what you were telling.
Sir, that was an excellent, sir, because that the same thing that we are thinking, because the in the metro cities most of their childs they are go outside for the job and all these things, and due to that they are unable to take care for the parents. So exactly the same concept we have begin with, and it's really we are very happy to be like listen from the expert like you that we are into the correct track that we are working on. And you are the, I think I have heard the first doctor who is doing this preventive measure by the mailing that you are asking for the blood pressure and the sugar level, what they are doing at home, and the physiological changes, because I interacted with many doctors with during my journey of this research and all this thing. I find it out like you are the first doctor that I have listened like this in.
I told you data of a few thousand patients.
Yeah.
They mailed me the number of steps they have walked. They mailed me the number of calories they have consumed.
Okay, okay.
Doctor, I have consumed 1,000 calories per day. I walk 15,000 steps per day. My post-meal sugar is 120. My BP is 110 by 70 today. You see that Excel sheet which goes on for years together.
Okay.
This is from Bangladesh. This is from Bangladesh. Excellent. Once they understand the basic concept, they never leave. They don't go to any other doctor. They keep mailing back to you because they are
Definitely.
satisfied and happy.
So, sir, one thing that I also that is coming in my mind, like, do you think, sir, because I've been reading some of the articles also and the cancer.uk.gov also, we've been reading
Yeah.
first of the two sentence itself like cancer-like diseases or the heart attack-like diseases in the very
Yeah.
beginning stage due to the physiological changes. Is it possible we
Yeah.
can estimate these changes and we can estimate like the future, the probability of happening this certain critical complication for any patient, the past physiological data and their habits and behavior, high BMI score according to the diets and all these things. Is it possible like physiological changes can act as a marker to identify the future diseases?
In diabetes, hypertension, stomach, pancreas, or colonic cancers at an early stage, we do it as a screening in patients who had a family history of stomach or colonic cancer.
Yeah.
In others, like smokers or tobacco chewers, we do a routine, thorough examination of the oral cavity,
Mhm.
and we do an X-ray and we look for lymph nodes around the neck. And also, we have a robust program where we push them into the tobacco cessation clinic and alcohol stopping clinic. So we have a system where if we identify these patients early when they don't have any complication, and push them into the clinic where they stop tobacco or alcohol, and also follow them.
So, sir, like I just wanted to ask one thing, like, would you like to use our services if we have, because we've been recently accelerated through the Microsoft Accelerator, we've been selected over there. So we have the very, it is a very is a one or two step process of the login and nothing more than that. Like Dinakaran, if you like very quickly, you could. Uh, sir, like in this direction, what do you see as a market potential for our product and services?
You have a very huge potential. It's like you see people sitting in the OPD in a big queue, waiting for their BP to be checked, waiting to see the doctor. That can be prevented because the patient is sitting at home sending his logs, and we believe that with the traffic, okay, getting an appointment with a good doctor is so difficult. It's so difficult, and if they know that their health is in good hands, and in case of an emergency, they will be taken care of well. They would not really worry too much. So the patients who come in every month to our clinic are those with high blood pressure, high blood sugar, okay, high cholesterol. We give them the same advice what we give here. Okay, if we have a bunch of evidence, all their reports, I would want your app to give me all the data. I can put them together and tell them, look, you are going wrong here, here, and here.
Yeah.
You need to change your diet. You need to increase your physical activity. You need to change this medication, and you need to update me every 5 to 7 days, and I will keep guiding you. So I can do that. So this will one. Their son is somewhere in US. The father is in India. The son is satisfied. The father is happy, and I'm also happy that.
Advertisement platform, exactly. Yeah, definitely. So it's a very much like user friendly. So we don't have any and a very system security we have integrated. So there is nothing like advertisement or anything. So that will be the thank you so much, sir. It was a very wonderful interaction with you, and you just given the very helpful insight. And like apart from that, like thank you so much for Rohit sir, like interacting, like he just made us connected with you and get us in some expert guidance from your side. So this is the overall, sir, we are trying to do. We are trying to create an ecosystem of the cloud diagnosis in India. Like for the early diagnosis thing can be accessible from anywhere all across the India. And so far we have the 10 NGOs all across different places from the Kashmir, South Karnataka, and the Chennai and Delhi region. So they are doing the health campaign from our technology that we are giving our tools to access that patient physiological data analysis. So in return, we are giving them a report feedback that you have a chances of getting this certain thing. So we are executing in this way. So we've been definitely wanted to be an associate with you for a long term, like whatever it will be there, because since you've been a very healthcare expert and that you are doing in this thing for a very long time, so definitely it will be we can improve over the efficiency of the product also in analytics platform, because overall we are trying to make it out to predictive analytics very easy because the user can track and monitor their health. It will also going to be access their parental information okay they have the any other things or not, so that way it's going to be work it out. So thank you so much, sir. Thank you very much, Dr. Mahesh. Thank you so much for like your valuable insights and encouraging our product and things. Thank you very much. Thank you so much. Thank you so much, Doctor. We will be very happy to associate with the expert like you. It will be going to be highly encouraging for us also. Like it will be very helpful for the startup entrepreneurs like me. This year is also my final year for the PhD, so I'm also going to be submit this thing. So that is also we are trying to do. So it's going to be very happy. We will be connected and we will work together. Thank you very much, sir. Thank you so much. Thank you so much, sir. Have a great day. Thank you so much, Rohit sir. Okay, now I will also disconnect.